This is Mark Gunn Media.
Hit it!
Welcome to Gunshots Straight from the Hip. I'm your host, Mark Gunn. The views expressed on this program are those of the host and guests and not necessarily reflective of anyone or any entity associated with this broadcast. This episode is brought to you by the Centers for Disease Control.
The best way to protect yourself from 2019 novel coronavirus is to avoid being exposed to the virus. Additionally, there are preventative actions that you can take to protect yourself and your family from the spread of respiratory viruses that can make you sick. These include stay home if you're sick, cover your cough, and wash your hands.
For more information, visit coronavirus.gov. That's coronavirus.gov. This episode, COVID-19 and racial profiling. All right, so we go through another week of quarantine, and there's more and more data coming out about how the COVID-19 pandemic is adversely affecting Black people in more ways than one. Not that we weren't already dealing with enough crap as it is.
There's literally no way that I felt comfortable and or safe walking into a convenience store, a grocery store, a pharmacy with a bandana or something else like a scarf covering my face. Right. You know, Black folks are hyper aware of the danger that awaits us every time we leave the house.
So you've got a lot of states recommending that people wear masks in public in order to protect themselves and others from getting the virus. Cool. I get that. But what happens when you're masking while Black?
Hey, so we were in Walmart and what's this, Wood River? And Wood River, Illinois. This officer right here behind us just followed us in the store. You just video. He said we can't video, but he just told us we're on body cam. He just followed us from outside, told us that we cannot wear masks. There's a state order, and he's following us right now to the store. We're being asked to leave for being safe.
And then there's the story of Dr. Armen Henderson, who was an internal medicine specialist and the assistant professor of medicine at the University of Miami. Now, while we're continuing to sing the praises of doctors and nurses putting themselves on the front lines to help us with this virus, this brother was arrested outside of his home for doing the same thing, volunteering while Black.
Yeah, so I was pretty much just putting tents in my car. I was loading other supplies into my van. You know, while I was doing that, I noticed that the police officer rode down the street, that a cross-section of my block, one way, really slow, and then he came back around the street the other way and basically turned down my block. And he pulled up next to me, questioning me if I lived there, if I worked here. I told him that I lived there. I told him what I was doing. I told him that where I was putting the boxes was where the city of Miami comes to pick up our trash every week. At some point, he just didn't believe what I was saying, or he thought that I was being disrespectful and decided to get out of the car and escalate the situation. Once he got out of the car, he asked me for ID, which I said I didn't have. I was trying my best to keep cool during the situation and, you know, remain steadfast on what I was doing, which was to be at downtown Miami delivering food and tents to homeless individuals that live downtown. And so I pretty much went ahead and continued to do what I was going to do because I didn't know where this encounter was going. And then he just decided to put cuffs on me, basically. Once he put cuffs on me, I called for my wife. She came out and pretty much de-escalated the situation. But even before she came, he was like inches from my face, basically yelling that I should call him sergeant, I should call him sir. And with no mask on, he had no gloves on. I could feel his saliva on my lips. It was just a crazy encounter. While he was in my face, I pretty much kept quiet, and I was just waiting for my wife to come, basically. Once she came outside, she basically asked why I was in handcuffs, and she said that we live here, and he said, well, I'm going to need to see some ID. Go get it for me. And so she went in the house, got her ID, showed him that we actually lived here, and at that point, he pretty much just let me go. I want the officer held accountable. It's no way that you racially profile me and then you arrest me, you detain me, and then during a pandemic where you have no mask on, where hundreds of police officers throughout Miami-Dade County have tested positive, and you're up in my face, spitting on my lips when we're supposed to be practicing social distancing. You know, he just broke a number of protocols and violated my rights. So firstly, I want him held accountable, and I want an apology as well. But outside of that, I think the bigger picture is that I was going to serve homeless individuals throughout Miami-Dade County, that the city has said we have to shelter in place, we have to socially distance. And for someone who doesn't have a house, for someone who lives unsheltered, it's very impossible to do those things. And in a pandemic, these are the most vulnerable individuals. These are the individuals who we're supposed to be paying the most attention to, because these are the individuals that sleep on buses, on bus stops, benches. Because of that, when you're talking about public health response to a pandemic, you have to focus on those individuals who are using the public space. It's been hard to get testing if you're not a basketball player, if you're not a rich person. And so literally, we just been going out and first of all, we did a survey of individuals to see what their symptoms are, and we identified people who needed to be tested. But then because we are the epicenter of the epidemic, and this is the most vulnerable population, I just figured that we should be testing people at random as well to sample population sizes to see how far this virus has spread already. And honestly, though, this is supposed to be the city and the county's job in doing this, in providing necessities and testing individuals that are in this vulnerable population. And I think it just speaks to the fact that I even have to do this. You know, it shouldn't be my job to volunteer out there to make sure that homeless individuals are cared for, especially in a pandemic.
Okay, so we're kind of damned if we do and damned if we don't. You want us to social distance, cool. You want us to wear masks in order to protect ourselves and others from the virus. Also cool. But how is it that we're still having to put up with the same racist crap that we've been putting up with long before the pandemic ever came along? Well, USC law professor Jody Armour explains.
The dilemma is really facing black folk who are thinking about wearing bandanas and other makeshift masks to reduce the risk of not only contracting COVID-19 ourselves, but to show care and concern for the health and well-being of others around us by wearing masks that protect them as well. Here's the dilemma we seem to confront. Do I decrease my risk of contracting COVID-19 and decrease my risk of spreading that infection to others around me? And to do that, I must increase my risk of being mistaken for a dangerous criminal. You know, it's kind of a pick your poison situation. You decrease your risk of contracting COVID-19 and of spreading it to others by wearing masks that increase your risk of being mistaken for a dangerous criminal and possibly either getting gunned down or perhaps even thrown in jail and packed with others who are potentially infected people and worsening your plight that way.
And as if that weren't bad enough, over in China, oh man, black people are catching 3 shades of hell.
City leaders in southern China are denying allegations of coronavirus racism, insisting that foreigners are not being discriminated against. Africans living in Guangzhou say that they're being kicked out of their homes and face harassment as health workers step up testing for imported infections. The African Union, Nigeria and Ghana are calling on the Chinese government to address concerns. Professor Keith Richberg is the director of the Journalism and Media Studies Centre at the University of Hong Kong. He says there has been discrimination against Africans living in China for some time now.
Ever since Xi Jinping announced that the virus was essentially contained in China and that they could start reopening businesses and reopening factories, the numbers have been going up, but they've been blaming all of those new numbers, those new cases and the new deaths in China on what they call imported cases, meaning that they've contained it in China, but people coming back into the country are bringing it along. It smacks a bit of xenophobia to me because, number one, most of these so-called imported cases are Chinese nationals who left at Chinese New Year and are just now returning or returning from schools abroad, et cetera. So these aren't foreigners, these are Chinese who are bringing in with the virus. And secondly, they've been given really no statistics to prove that the real numbers of people coming in with the virus are actually foreigners at all. But that's kind of the narrative or the storyline that they'd like to say is that all of these new cases are all from foreigners. They've even restricted foreign diplomats from coming back into Beijing, for example. China has always had this kind of complex relationship with Africa, whereas the Chinese simply don't like them very much. They're basically kind of, there's a lot of racism. I've been to Guangzhou. I've been to that area that they call Little Africa, or more derogatorily, they call it the Chocolate City. The Africans tell me they feel discriminated against by the Chinese.
And now you've got the dumbass in the White House and several governors across the country talking about opening up their states.
Governor Kemp just announced that he wants to reopen a number of businesses that include massage parlors, nail salons, tattoo parlors, as long as you're able to maintain social distancing and keep sanitary standards. I'm just a little confused. How do you keep social distancing at a nail salon or a hair salon or a barber or a massage parlor?
This dude is in charge of the state of Georgia. This is the same idiot that you got to hear this for yourself.
Georgia Governor Brian Kemp is being ridiculed widely because after weeks of wall-to-wall media coverage of the coronavirus, he claimed he just learned that people without symptoms can still spread the virus. This led to the social media hashtag CDC is in Atlanta, the very agency that has been explaining the risks of the virus to the American people. The Centers for Disease Control is in Georgia. It's about a 20-minute drive from the governor's mansion.
According to the last numbers available, the coronavirus has affected over 21,800 people in the state of Georgia alone. Needless to say, various mayors are not happy about the governor's decision, including Atlanta Mayor Lakeisha Bottoms.
My mother owned a hair salon for nearly 25 years, and I sat in there day in and day out watching people get their hair done. I've never seen anyone receive a haircut from someone who stood 6 feet away from them. I think it's ridiculous. As I thought of my mother, I thought of her trying to read through and understand and comply with OSHA guidelines. It's nonsensical. I am struggling as mayor of Atlanta to get PPE for my sanitation workers. We are bidding and competing with municipalities and states and the federal government just to get masks and gloves for our sanitation workers. So you now are expecting the barber to go out and compete in the open marketplace for masks for every customer who comes in. We have doctors and nurses who are saying to us that they are being exposed because they aren't adequately protected. Yet I expect the woman who does my nails to know how she is to clothe herself and her customers to provide a service. It doesn't make sense. I've tried to look at this from every angle possible, and it is illogical, and I think that it is irresponsible.
And as far as the state of Georgia goes, there are quite a few people that think that there may be an ulterior motive to some of the businesses that are being allowed to open. I'll explain right after this.
We know that we're asking Americans to do a lot right now. So we're asking everyone to be selfless for others so that we can protect those who are most susceptible to this virus.
A question I often get asked is why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
Social distancing is really physical separation of people.
It's what we refer to when we ask people to stay at least 6 feet apart.
Not going to bars, not going to restaurants, not going to theaters where there are a lot of people. It all just means physical separation so that you have a space between you and others who might actually be infected or infect you.
We all have a role to play in preventing person-to-person spread of this disease, which can be deadly for vulnerable groups. For more information on how you can social distance, please go to coronavirus.gov.
For downloads of this and past episodes and information about all the multimedia services we offer, log on to our website at www.markgunmedia.com. That's markgunmedia.com. Welcome back to Gunshot Straight from the Hip. This episode, it's COVID-19 and racial profiling. We've been looking at the disparities as it relates to black folks and this awful, awful disease. Now, before the break, I talked about how Governor Kemp of Georgia and several other states are reopening their economies, and how some black folks are thinking there's a little more to it, something a lot more insidious. Now, beliefs like this aren't new. After all, Black America has a huge, huge issue of trust when it comes to the medical community, and one need only go back to one awful period in American history to figure out why.
6 decades ago, indifference and injustice combined to begin to write one of the most shameful chapters in the history of American medicine. Of course, the infamous project called the Tuskegee Study of Untreated Syphilis in the Negro Male. In 1932, America's Public Health Service set out to study syphilis, but it pursued this worthy goal in a manner that was irredeemably cruel. Several hundred African American men the Public Health Service recruited at churches and clinics and farms were used in the study. Most of these men had syphilis. None of them knew their bodies harbored this disease. And then the Public Health Service followed the men's lives, watched how the disease developed, all the while withholding medicine, withholding treatment of any kind for these innocent American citizens. Medical professionals willingly, intentionally let human beings suffer from a treatable and then later a curable illness. These researchers knew that mercury and arsenic compounds could treat the disease, but the Tuskegee men did not receive the medicine. Later, the researchers knew that penicillin could cure the disease, but again, the Tuskegee men did not get the medicine. They didn't get treated until the 40-year study was discovered and stopped amid public outcry in 1972. It was a disgraceful episode for American science. We feel the repercussions still, tremors of distrust that have not yet disappeared. To this day, the Tuskegee study makes some Americans think twice about donating blood or taking their children for vaccinations or signing an organ donor card.
When you stop to think about the fact that a majority of the COVID-19 cases in quite a few places are being suffered by black folks. As a matter of fact, 80% of the cases in the state of Georgia alone have been contracted by black people. Put that together with America's shameful past as it relates to medicine, and it's no wonder that people are suspicious of what's going on with COVID-19. Why are Africans being scapegoated in China? Why are specific businesses in the state of Georgia being open? You know, beauty shops, barber shops, gyms, bowling alleys, places that black people frequent quite often. That does give one pause. You also have to take into account the external influences that have led to the disparities that we're seeing long before COVID-19. Dr. Patrice A. Harris, president of the American Medical Association, explains.
I hope that everyone knows that African Americans already were suffering with inequities regarding health and had a disproportionate impact when it comes to diabetes and hypertension, high blood pressure. And so we know those are risk factors for worse outcomes with COVID-19. And we don't have the data right now. There's been some promising data, some small stories of success, but we don't have the data about how it will interact with other medications. There's a medication that I prescribe as a psychiatrist that could cause heart arrhythmias. We have to have the data. We have to be careful. Physicians, it's a position of trust, and we need to be very judicious in our recommendations, and our recommendations have to begin and end with the science.
They say that the COVID-19 virus doesn't discriminate, but the American healthcare system sure does, which is why black and brown people are in the state they're in today. More of us are getting the virus, and we have fewer resources in order to get help. Dr. Uche Blackstock, an urgent care physician and founder of Advancing Medical Equity out of New York, breaks this down for us.
Even thinking about the testing criteria that was initially being used to determine whether or not someone had exposure to COVID-19, it included the person needed to have traveled abroad to one of the countries where COVID-19 was endemic, like Italy or China. Also required someone having to know someone who had tested positive. And what we knew very early on was that, there were communities that did not have access to testing. We had heard of celebrities and politicians having very easy access to testing and quick turnarounds. And these are communities that already carry very high chronic disease burdens like diabetes, high blood pressure, asthma. There are also high rates of obesity. And, these have all been tied into racial health disparities linked to structural racism. So it's already kind of made these patients and these communities more vulnerable to COVID-19, as we're seeing that these patients are at increased risk for developing very serious complications.
So when we talk about racial disparities as it relates to health care, not only are we talking about access, we're also talking about how patients of color are actually treated by their physicians. And one has to ask, how does this play into COVID-19 treatment?
What we already know, as you alluded to, is that when Black and brown people interface with the healthcare system, they often encounter provider bias. So we know, and it's well documented, that their pain is undertreated or their complaints are minimized. So my concern is that when these patients present to emergency departments and hospitals in their areas with COVID-19 symptoms, that their symptoms may be downplayed or they may not be taken seriously. And we do already have the data to support that trend continuing to happen.
Taking all of this into consideration, Doctor, how do you feel about the outcome?
I'm scared. I'm scared that these communities are going to be absolutely ravaged and devastated by COVID-19. I mean, when I think about how each day last week I just saw sicker and sicker patients, it was significant and it was also terrifying. And so I do worry, and we already actually have some of the preliminary data out today in the New York Times that our poorer areas of the city, which are mostly Black and brown, have the heaviest number of patients that have been affected with coronavirus.
Dr. Uche Blackstock, who works as an emergency care physician and is the founder and CEO of Advancing Medical Equity. So there are a couple of conclusions that we can draw on from what you've just heard. One, COVID-19 is very serious, and we as a community have to take it seriously since we are the ones being affected more than anybody else. And two, despite dealing with a pandemic that can wipe out literally millions of Americans, this country still has its head up its ass when it comes to issues of race. Here's hoping you and your family stay safe. Social distancing is the rule. And we'll check you out next week. You've been listening to Gunshots Straight from the Hip. The views expressed are those of the host and guests and not reflective of any business entity or anyone associated with this broadcast. If you have any comments or want more information on how to be a sponsor, log on to our website at markgunmedia.com or call us at 502-407-0283. That's 502-407-0283. Thank you for listening.
Mark Gun Media. No hype, no hoopla, just damn good work.